Morning students, my name is Sreema Jeevan. I am dealing community health nursing for you. Unit number 4, Epidemiology and the nursing management of common communicable diseases. The previous classes and all we have learned about the types of communicable diseases depending upon the sources. We have learned categorized as the 4 sections. First two we have learned. The first one we have learned is respiratory infections, communicable diseases under that one. Then second one we have learned about the intestinal infections. And today we are going for learning the third section, that is arthropoid infection. So what is arthropoid means? Insects only. Okay, so it is the infection which is caused by the insects bites and all we can able to call as a arthropoid infections. So there are mainly four arthropoid infections are there. So first one is dengue infection, the dengue fever. Then second one is malaria. Then third one is filariasis and the fourth one is zoonosis. So there are four main type of arthropoid infections. So first one dengue, second one malaria, third one filariasis and the fourth one is zoonosis. So it's a arthropoid infection means infection which is caused by the insects bites. We'll see the first one, that is dengue. So dengue fever. So dengue fever is a mosquito-borne tropical diseases caused by the dengue virus. So it is a mosquito-borne diseases, tropical diseases only which is caused by the dengue virus. We'll see the incubation period. The incubation period of dengue fever is 3 to 14 days. Or commonly we can able to see this incubation period in the form of 3 to 10 days also. Okay, so the incubation period of the dengue fever is 3 to 10 days and commonly seen as 3 to 10 days. Then causative organism. So what is a causative organism? I have showed in the introduction itself. The causative agent of this disease is dengue virus. Arbovirus. So usually the arthropoid infection is caused by the arbovirus only. So it is also will be coming like that only. Then the fourth section is mode of transmission. So the mode of transmission, how it is transmitting from one thing to next thing. That is, we'll see. The dengue fever is transmitted to human through the bites of infective female Aedes aegypti mosquitoes. So it is actually a female mosquito only. So what is the name of the mosquito here means female Aedes aegypti mosquitoes, which will be causing the dengue fever. So we'll see the cycle, mode of transmission cycle. First we can able to see the infected mosquitoes. Then in the right side we can see the infected person, left side we can see the healthy person. Okay, the healthy person become a infected person. How the healthy person become a infected person means from an infected female Aedes aegypti mosquito, the infected person will be arriving. So what happened here means, firstly, how the mosquito also becomes infected means from an infected person, the mosquito will come for the biting, for sucking the bloods and all. Once the mosquito is sucked from an infected person, that is which is the person is having the dengue, what happens is the mosquito will be going for carrying from the infected towards to the non-infected person. So this infected mosquito will be moving towards the healthy person for sucking the blood. So what happens is from the infected mosquito the virus will be moving towards the healthy person. So at present what happens is the healthy person becoming a infected person. So firstly the mosquito will be female Aedes mosquito will biting towards the infected person. So what happens is the mosquito also become as infected, and this infected mosquito will go towards the healthy person for biting means the healthy person also becoming as infected from the mosquito. So this cycle will go for in the period of dengue sections. The next one is types. Symptoms. Dengue fever symptoms. Clinical manifestation will be exhibited by a dengue patients. So first of all, because of the infection and the person will be getting the rapid pulse will be there. Then dizziness, adenomia, then insomnia. So that is weakness, tiredness, fainting and all will be there. Then insomnia will be there, fever will be there, then redness in the throat, you can see the redness will be formation, then joint pain will be there, then anorexia, vomiting, then red eyes, the redness of the eyes. Then what you feel is a dengue fever patient will feel as more heat will be developing from the body. Then rashes, the whole over the body the peoples will be getting the red rashes because of platelet low only. Platelet count become decreased, that because of that one what happen is red rashes will be forming in the bodies. Okay, so first of all, infection, because of infection rapid pulse will be there, then dizziness will be there, adenomia will be there because some will be getting the tiredness, weakness and all, then insomnia, then fever, redness of the throat, then pain in the bones, then anorexia, vomiting, redness of the eyes, then person feel for the evolving of heat will be there, and all over the body the patient will be having the rashes. So these are the symptoms which will be exhibited by a dengue patient. So if you are not treated properly, the person will go for the death because of decreased platelet count. Then we'll see next one is laboratory investigations. In this one we'll see the full blood counts and all count we'll see. So especially we'll go for seeing in the dengue fever cases platelet count. So platelet count usually it will go for decreasing and all. So if you are not treated properly the count and all, what happen is the person will go for the death. So first of all, in the dengue fever we'll see the blood counts. In that one we'll see the first one is platelet count and all. So platelet count we should maintain towards the normal. So if it is becoming as less means the person will get the more rashes will be forming. So especially we are seeing the dengue fever, the laboratory investigation is blood count only. Okay. Then second one is viral isolation and serotype identification. Third one is nucleic acid detection of the virus only. Okay. Then next one is antigen detection or the IgM rapid test and all we can able to go for using here. That is with the help of one card only, card tester. So the next one is IgG paired sera by the ELISA test. So main laboratory investigation for the dengue fever is analyzing the platelet count. So in the dengue condition, the platelet count become as decreased. Then we will see the management. So presently, first of all, there is no specific treatment for the particular disease condition. So what we are doing the treatment means management of dengue fever is symptomatic treatment or supportive therapy only we are giving, because so as per the symptoms we can give the treatment. First, if the person is having the fever is there, we will give the antipyretic. If the person is having the pain and all is there means analgesics and all we can give. Okay, but in this case we are having some changes is there. So we'll see the first one, the bed rest. Because of more acute sections and all, we will tell the patient to go for taking the bed rest. Second one, because of high grade fever in this condition, we will advise the person to go for doing the cold sponging, or we'll go for helping the person to go for doing the cold sponging to reduce the temperature to the normal. Third one is, if it is not reducing means we'll give that medicine that is antipyretic. We can able to go for giving to go for reducing the temperature. Then this is the important sentence. That is first one. Aspirin or NSA ideas like brufen should be avoided since it because of can able to go for causing the gastritis, vomiting, acidosis and platelet dysfunction. So because especially for the platelet dysfunctions, we are not at all using the aspirin, brufen or NSA ideas, other material, other drugs and all. Okay, why? Because the platelet dysfunctions will be there. Then next one, paracetamol is preferably used to follow 1 to 2 years, that is 60 to 120 mg per dose. We can give 3 to 6 years means we'll give the 120 mg per dose. Then 7 to 12 years means 240 mg per dose. Adult means 500 mg per dose. And in case of children means the dose calculation we are doing, that is 10 mg per kg body weight as per the dose, which we can repeated all the intervals of 6 hours. So we are giving in the interval of 6 hours. So different as per the years the dosage will be varies, that is varies from person to person. And especially for in case of children's, the dose we are going for calculating as per the 10 mg. So 10 mg per kg body weight per the dose we are giving. So every interval of 6 hours we can able to give the medications, that is paracetamol dose. Then fourth one is oral fluid and electrolyte therapy are recommended for the patients with excessive sweating or vomiting. So in cases of vomiting and all, sweating and all, so what you are going for giving the therapy is oral therapy we can able to give. Then the fifth one is the patient should be monitored in HDF endemic area under they become a febrile form of 1 day without the use of antipyretic, and after platelet and hematocrit determination are stable. That is, the platelet count is less than greater than 50,000 CUMM, cubic mm. Okay, so in case, so we'll go for doing the test and all in between. So we'll go for seeing the patient should be continuously monitored towards the level of platelet count and all. So daily we'll go for checking. So once it is reducing towards the 50,000 and all means we'll not only 50,000, 80,000 less and all means we'll give the rapid treatment and all. So if it is below towards the 50-40s and all means the person will go towards the dangerous. This more complication will be for, there towards the patient to go for collapse and all, shock or collapse and all. So before that itself we should give the treatment therapy we should go for giving, that is platelet we can able to go for giving, plasma therapies and all we can able to go for giving. Then about the vaccination in case of dengue means currently there is not available, and estimation of 5 to 10 years within that one dengue vaccination will come like that. The researchers they are telling the vaccination is development is a problematic one, and this vaccination must provide the immunity to all the 4 serotypes and all, and actually it is not possible at present. So what they are telling me is it will take the availability for the 5 to 10 years and all, and the lack of dengue animal model is then live attenuated tetravalent vaccination under the phase 2 is going for the trial. Trial run will be there to the particular locality peoples in the prone area and all, dengue prone area and all. The next one is new approaches including the infectious clone DNA and naked DNA vaccinations. Okay, new approaches are there for the vaccination, DNA vaccinations and all, but at present there is no dengue vaccinations. Then we'll see the prevention. The personal preventions are there and the environmental preventions are there for the dengue fever. So we'll see the first one is personal prevention. Clothing to reduce the exposed skin. So we'll tell the people to go for wear the up to the foot dress and all up to foot. So because if wherever the skin is exposed means the mosquito bite will be there. Then second one is insect repellent, especially in the early morning and late noon, and also coils, mosquito coils and all we can able to go for keeping, that is repellents. Then bed net is important, so mosquito net and all we can able to keep. Then mosquito repellents, that is pyrethroid based only, so it should not be harmful towards the children. That's why it become as mosquito repellent pyrethroid based. Then coils, that is mosquito coils we can use, and sanitation measures and all we can able to go for using as a personal. Clean the environments also. Okay, so second one is environmental prevention, reducing the vector breeding site, because dengue fever, that is Aedes mosquito which will be breeding in the fresh water. So what the glass of fresh water, and if you are keeping for a long days and all, it can able to go for breeding in the particular water. And so what you have to go for means especially in coconut shell and all. Okay, so what during the rainy season we should make it the downward. So cup should, all the cups, everything should be in a downward. The mouth of the glass and all should be touching towards the sand. Should not collect any water in the any of the areas, and wherever you are seeing the collected waters means you should drain it outside. Then only we can able to go for preventing the breeding sites and all. Then second one is solid waste management. So waste management is main prevention in the environmental sector. Then public health education, you should give the health education towards the people and awareness about the dengue fever condition and all. Then empty water containing and cut wet and tall grasses. So all the tall grasses and all we should go for cutting down. Then so whatever the water containers are there means outside and all, which will go for the breeding and all. So what you have to go for doing means take the container and empty it. So these are the points under the dengue fever. So I'll tell once more. Dengue fever is caused by the mosquito, female mosquito, Aedes mosquito only, which can able to go for leading complications also. That is regarding the platelet and hemocritic reactions and all. So main thing is platelet count become as decreased in the condition of dengue fever. So main treatment is to go for introduction or administration of platelet via the plasma content only, plasma in the blood. So we should go for preventing during the rainy seasons and all. So dengue fevers, this female mosquitoes will be breeding in the fresh waters only. So what will be there is whatever the container which containing the water should keep it empty. Next one is malaria. So malaria is a mosquito-borne diseases only. So it is infectious diseases that will be affecting towards the humans and other animals. The people with the malaria oftenly experiencing about the fever, chills, flu and illness will be there, and left if we are not treating properly. So what happens is this condition becomes as very severe complication and the people will go for the death. Okay, so malaria is caused by the mosquito-borne infection only. So, and the peoples will be exhibiting the some of the clinical manifestation as fever, chills, and flus, and or that is illness will be there. If you are not treating the properly, what happens is it become a severe complication, and the person will go for the death. So, in the year of 2018 and estimated 228 million cases are there of malaria in the worldwide and all. So 4 lakh 5,000 people were died, and mostly children in the African regions. So especially malaria will be affected towards the African area and all. So Africa area and all. So what happened here means in the year of 2018 there's estimately the survey has formed that is 228 million cases was there in the worldwide. Out of that one 4 lakh 5,000 people were died, and mostly it was children only we can able to go for seeing in the African areas. The next one is incubation period for the malaria, that is 7 to 14 days. So incubation period is 1 week to 2 week. Then we'll see the causative agent. So what is the causative organism? Means malaria is caused by one species, that is Plasmodium. So it's a genus Plasmodium containing 200 species are there. Out of that one, at least 11 species infect the humans. That is most important 5 are first one Plasmodium falciparum, Plasmodium malaria, Plasmodium ovale, then Plasmodium vivax, and Plasmodium knowlesii. So these are the mainly 5. So out of this one, in some textbook they will be mentioning only the 4 Plasmodium species, that is Plasmodium falciparum, Plasmodium malaria, Plasmodium ovale, and Plasmodium vivax. Okay, then Plasmodium parasites are highly specific with the female Anopheles mosquito. So Plasmodium parasites are highly specifically with the attachment towards the female Anopheles mosquito. So main causative agent is Anopheles mosquito only. Now we'll see the mode of infections. So biological transmission will be that is a female Anopheles mosquito. So first mode of transmission is biological transmission by female Anopheles mosquito. Second one is blood transmission. There are BTA, the blood transfusion and all will be there. So in that case also the infected, from an infected person, the blood is moving towards a non-infected person, means the non-infected person also becoming an infected person. So the third one is the use of contaminated syringe. So if the we are using the contaminated syringe and all, means pricking from by a contaminated syringe, that also leading towards the malarial cause. Then fourth one, congenital, that is uteroplacental, from the mother to the fetus. So there are 4 mode of infection transmission are there. First one is biological transmission by the female Anopheles mosquitoes, and second one is blood transmission and all. Third one, so once you are using the contaminated syringe, the pricking and all after the usage from an infected person. Fourth one is congenital through the placenta. So it's a uteroplacental from the mother to the fetus. We'll see the malaria transmission cycle. So here the first person, that is the first infected mosquito, will be going for biting a healthy person to become a first infected person. So in this infected first infected mosquito go towards the first person. So once it is sucking to a healthy person, the person becomes as first infected person. So what happened towards the liver of the first infected person means the liver cell become as damaged, that is become as infected liver cells, and this liver cells become infected the red blood cell. The infected red blood cell will be there. And once second mosquito is biting towards the first person, what happens is second infected mosquito. And this second infected mosquito will go for the biting of next person. That is, the person become as second infected person. So from the person, mosquito towards the person and person towards the mosquito, likewise it will be coming. So what happened means, firstly, one of the infected mosquito is going for biting a healthy person. So now the healthy person become a infected. That is, we can first infected person. So from this first infected person, what happened after this invasion of plasmodium species in the body means the liver damages and all will be the infected liver cells, infected red blood cells and all. From the first infected person, the mosquito will go for biting means what happened? The mosquito become as now infected. So this mosquito, second infected mosquito, will go towards the next healthy, second healthy person to become a infected, second infected person. Next one is symptoms of malaria. We'll see in the systemic way. So first one is central nervous area. So the person will go for getting the headache. Then next one, spleen. Spleen become as enlargement will be there. Then stomach, nausea, vomiting, abdominal pain will be there. In case of blood will be there in the stool. Then systemic one is high fever, back pain will be there, and profuse sweating also will be there in case of malaria. Then in case of lungs means dry cough will be there. Then muscle pain and fatigue will be there. The skin means chills and sweating. So these are the symptoms of malaria in system wise. That is, systemic is high fever, back pain, profuse sweating will be there, and in case of head means headache will be there. Then spleen become as enlarged, stomach is nausea, vomiting, abdominal pain, and in case of blood means blood will be there in the stool. Then lungs is dry cough will be there, muscle means fatigue and pain will be there, skin means chills and sweating. So these are the symptoms which is present in the malaria patient. Then we'll see the diagnostic evaluations. First of all, we'll go for taking the history collection, because the travel people center will go for getting the conditions and because of mosquito bite. Then second one is physical examinations. Then third one is rapid malaria. So main and foremost diagnostic test is investigation test is rapid malaria antigen whole blood test with the help of card only. Okay, so card test we can single kit card test we are using in case of detection of the malaria, that is of plasmodium vivax OVA and all. For that one, for understanding the antigen part, so we'll go for doing the card test, that is rapid malarial antigen whole blood test. So it's a card test only. Then we'll see the treatment. Anti-malaria drugs we are using. It is a combination with the mosquito control program. And it's historically played a key role in the controlling the malaria in the endemic areas, resulting in the significant reduction of geographical area of malarial diseases worldwide. So we are using the chloroquine, that is in the form of quinine dihydrochloride injections, and we can able to take, that is 600 mg per 2 ml, that is IM only we can able to give the anti-malaria drugs. Injections we are taking, tablets also is in the form, and injections also is there. So the malaria we can able to go for giving the therapies, anti-malarial drug. So it's a mosquito control programs have the historically played a key role in the controlling the malaria in endemic areas. So if, because of giving the medications in the endemic area, we after that one there is a significant result we has got, that is a reduction of geographical range of malarial diseases in a worldwide. Then last section, that is preventions. As a 2020 there is one vaccination for malaria, that is known as RTSS brand name has came, which is a licensed for use. Okay, so in the year, this year only it has sanctioned that one of the vaccination of malaria, that is known as RTSS brand 1. So it is a licensed one for using for the prevention as vaccination in case of malaria. So it's as shown in the picture, that is a vaccination successfully produced antibody in phase 1 trial has formed and contains plasmodium with 3 gens knocked out and limits the infection within the liver. Okay, then this is a vector management tool such as the insecticides and in the environmental modifications and we have used, and betters other preventions, that is environmental prevention and we can give, that is vector management tool, that is in the form of insecticides. Then bed nets and all we can able to use, that is personal protections to successfully the malaria control effects historically by the have to face the setback in the recent years due to the factors such as the emergence of insecticide resistance in the mosquito, because nowadays when you are keeping the mosquito coil and all means the insect mosquitoes are having the resistance to live in the particular environment. Okay, NIAID is supporting research on the new vector management strategies to prevent the parasite transmission from human towards the mosquitoes and mosquito towards the humans and reducing the mosquito populations and all. Okay, so we are giving one of the supportive researchers and all for the new vector management strategies for the prevention of parasite transmission from the human to mosquito and mosquito towards the human. So that's about the thing. Hope you all are understood about the malaria. So malaria is a same thing as towards the dengue. It's a mosquito borne diseases only. So there we learned about in the dengue fever it is a Aedes mosquito. In case of malaria it is a Anopheles mosquito. Okay, thank you.